The three physical factors that actually control or influence pulmonary ventilation are airway resistance, first of all, alveolar surface tension, and lung compliance. How well the lungs actually comply with the desires of the body, whether they expand easily or don't expand easily. So the first factor is the airway resistance. And the airway resistance is going to change according to the size of the bronchioles. So as we can see in this diagram, we can see, first of all, the resistance is on the left-hand side on the y-axis. At the bottom is the airway generation, and that's the stage of branching. Because remember, the bronchi, the main or primary bronchi, are going to get smaller and smaller. So over here at 1 would be the main bronchus, and as it continues to branch, the resistance increases here. And then as they get smaller, the resistance decreases because there's so many more bronchioles. So the air can spread out into many smaller tubes. So that's the big advantage of having so many generations, so many bronchioles. So at this point, where we have the terminal bronchioles, remember the terminal bronchiole is the last tube, the last part of the conducting zone. That leads into the respiratory zone where gas exchange happens. And at that point, that includes the respiratory bronchiole leading into the alveolar duct where the various alveoli are. So when the airway resistance is increased, when it rises, this is going to make the breathing more strenuous or more difficult. So as those tubes they're unable to conduct air through them because of resistance. Resistance could be in the form of mucus, some sort of obstruction. So when there's severe constriction or obstruction of these bronchioles, it could be life-threatening, and the person might need a ventilator in that case. So when the constriction happens, this causes the smooth muscle in the bronchioles to constrict. So one immediate way to hopefully correct this is with epinephrine and EpiPen, causes dilation of the smooth muscle of those bronchioles to reduce airway resistance. The next factor, the next physical factor affecting pulmonary ventilation is the alveolar surface tension. And this surface tension is the attraction of liquid molecules to one another in a gas-liquid interface. And so there needs to be something to reduce this surface tension now. So water has a very high surface tension. However, thankfully, our alveoli have surfactant. And surfactant is this detergent-like molecule, and it's produced by these type 2 alveolar cells, cuboidal in shape, and it prevents alveolar collapse. So one situation where there is not surfactant present is when there's premature infants. If they're born early, they have what's called ERDS, is the abbreviation for Infant Respiratory Distress Syndrome. And the reason it's for premature infants is the fetal lungs do not have adequate amount of surfactant until the last 2 months of development. So the very end of the 3rd trimester. And a lot of times this is prevented because there is spraying of synthetic surfactant in situations where the newborns don't have this surfactant that's present. And finally, the last factor that is going to affect pulmonary ventilation is lung compliance. And so lung compliance is the measurement of the change in the volume as it stretches. So basically, how much can the lungs actually comply? How easily can they expand or constrict? So they're normally very high because of the distensibility of the lung tissue. Normally, the lung tissue can expand very easily, and also the surfactant, which decreases the alveolar surface tension. But again, one thing that could decrease this lung compliance would be something like scar tissue, scarring of the lungs. So lung compliance is actually calculated by the volume of over the difference of the volumes, but that mathematical calculation is not important to use. Essentially, the concept is what's important. So the decreased flexibility of the thoracic cage can determine lung compliance, also the formation of scar tissue, fibrosis, or a reduced amount of surfactant. So you should know that all of these three things affect the compliance. So the flexibility of the thoracic wall, for example, would decrease the chest wall compliance if there's severe scoliosis as well. So an anatomical abnormality could affect the flexibility of the thoracic cage. So a couple homeostatic imbalances that relate here are when there's a decrease in the natural resilience of the lung compliance, maybe due to something like fibrosis, the formation of scar tissue, the decreased amount of surfactant, and this could lead to inadequate inflation of the alveoli. So the way to correct this is lower the compliance. The more energy is needed just to breathe. So people that have low lung compliance are exhausting themselves from using that energy just to breathe. The other thing that can affect compliance is distensibility of the thoracic wall. So this could be due to anatomical abnormalities. In older age, there's an anatomical decrease in the size of the thorax itself. Again, scoliosis could affect this if there's a decrease in the chest wall size also.